Hello everybody, welcome to my channel. In this video, we are going to see about the infrahyoid muscles. So the infrahyoid muscles are nothing but the muscles below the hyoid bone, which are also attached to the hyoid bone. The first muscle we are going to look through is the sternohyoid muscle. By the name itself, you can come to a conclusion that the muscle is attached to sternum as well as to the hyoid bone. So come, let us see about the origin and insertion of the muscle. So here you can see the origin of the sternohyoid muscle. So it takes origin from the posterior surface of the manubrium sterni and also from the sternal end of the clavicle and also from the posterior sternoclavicular ligament. That ligament is not shown here. And coming to the insertion of the sternohyoid muscle, here you can see the insertion of the muscle. So it is inserted into the lower border of the hyoid bone and that too on the medial portion. You can see this is the body of the hyoid bone and this is the lesser carnova and this is the greater carnova. So in the body at the middle portion and that too on the lower border, it gets attached. Rather to say that it is attached, it gets inserted. You can see how it is inserted. Here you can see the lesser carnova and this is the greater carnova, and here you can see the insertion of the sternohyoid muscle. Now coming to the nerve supply, it is supplied by the ansa cervicalis, the branches of the spinal nerves of C1 to C3. During vocal movements and swallowing, the hyoid bone elevates. So the main action of the sternohyoid muscle is to depress the hyoid bone following its elevation. So the second muscle we are going to look through is the sternothyroid muscle. By the name itself, you can come to a conclusion that the muscle is something which is attached to the sternum as well as to the thyroid cartilage. So I am hiding the sternohyoid muscle so that there may be a clear view of the sternothyroid muscle. So here you can see the sternothyroid muscle. Let us take a look through its insertion and origin. So this muscle takes its origin mainly from the posterior surface of the manubrium sterni and also from the adjoining part of the first costal cartilage. Then coming to the insertion, it is inserted into the oblique ridge on the thyroid cartilage. On the anterior surface you can see there is an oblique ridge in the thyroid cartilage, and this muscle gets inserted into the oblique ridge on the anterior surface of the thyroid cartilage. Now coming to the nerve supply, this muscle is also supplied by the ansa cervicalis by the branches of the spinal nerves from C1 to C3. So coming to the action, like the hyoid bone, the larynx is also elevated following the swallowing and during vocal movements. So that also elevates, larynx also elevates. The main function of this muscle, sternothyroid muscle, is to depress the larynx after its elevation. So the main function of the sternothyroid muscle is to depress the larynx after its elevation. So the next muscle we are going to look through is the thyrohyoid muscle. By the name itself, you can infer that it is something related to that of the thyroid cartilage as well as to the hyoid bone. Coming to its origin and insertion. So this muscle gets its origin from the oblique line on the thyroid cartilage on its anterior surface. And coming to the insertion, it gets inserted in the lower border of the hyoid bone and that too in the meeting point of the body of the hyoid bone and the greater carnova of the hyoid bone. So this is the meeting point of the body of the hyoid bone and the greater carnova of the hyoid bone. So at that point, that too in the lower border, this muscle gets inserted. This thyrohyoid muscle gets inserted. Now coming to the nerve supply, this muscle is supplied by the anterior ramus of the spinal nerve C1 through the hypoglossal nerve. Then coming to its action, this mainly depresses the hyoid bone and it elevates the larynx when the hyoid bone is fixed. Hyoid bone is usually kept in its place, fixed by the suprahyoid muscles. So whenever this hyoid bone is kept fixed in its place, this thyrohyoid muscle helps in the elevation of the larynx. So the next muscle we are going to look through is the omohyoid muscle. This is the last muscle we are going to see, and the infrahyoid group of muscles. So here you can see the superior belly of the omohyoid, and this is the common tendon, and this is the inferior belly of the omohyoid. This is a muscle something related to that of the hyoid bone as well as to the scapula. So now coming to its origin and insertion. So here you can see its origin from the upper border of the scapula near the suprascapular notch. It also takes its origin from the adjoining part of the suprascapular ligament. Few fibers take origin from the suprascapular ligament also. So this posterior belly of the omohyoid, that is the inferior belly of the omohyoid, it is connected to the common tendon. So this inferior belly of the omohyoid is connected to the superior belly of the omohyoid through a common tendon. Now coming to its insertion. So it is inserted into the lower border of the body of the hyoid bone, and that too lateral to that of the insertion of sternohyoid muscle. Now coming to the nerve supply, the superior belly is supplied by the superior root of ansa cervicalis, and the inferior belly it is supplied by the inferior root of ansa cervicalis. This muscle also helps in the depression of the hyoid bone, following its elevation during swallowing and vocal movements. These are the infrahyoid muscles. So again I am pointing out the infrahyoid muscles just for a clarification. So you can see here the sternohyoid muscle, the sternothyroid muscle, thyrohyoid muscle, and the omohyoid muscle. These are the infrahyoid group of muscles. So hope you like this video. Do subscribe and stay in touch. Thank you.